Hi, everybody. Dan Muncie here from the Tech Council. I'm the chairperson of the International Association of Fire Chiefs Tech Council. It serves as a knowledge center for the technological developments that are affecting our fire service and public safety in general. This is an international forum of information, knowledge exchange with different stakeholders. Our vision is to advance the fire and rescue EMS services and allied agencies to be on the leading edge of the technological adaptation. Today, we're joined by Michael Ochoa from Transcend Health. And as we're thinking about being able to provide service to the citizens and the residents that we serve, we also provide a great service to our employees to make sure that they feel supported to do the job. So we're really excited about this presentation. So Transcend Health, I've had the opportunity to be reviewing this technology for almost a year. It was brought to me by our county Board of Supervisors chairman, who's very interested in technology and taking care of our firefighters. And he pointed out that with the Internet of Things and all the data points that can be collected, we can do better at monitoring our firefighters and our workforce on a day-to-day basis. So Transcend Health takes this information that can be collected, and they'll describe to you how that's done, and they use artificial intelligence to make interpretations. And then they provide a custom fit solution, not only for the region that you may be in, not only for your organization, but for your individual employees. So we're really excited to have Michael Ochoa joining us today, and I'm going to turn this over to Michael Ochoa. A couple of housekeeping things as we start. Mike, I'm sorry. There will be question and answer that you'll be able to see in your screen, and if you could just go ahead and put your questions up, we'll make sure that we answer that probably at the end of the broadcast. But if there's something pertinent, I'll make sure that I stop and I ask Michael that question. Again, I want to thank our sponsor, Transcend Healthcare. Michael.
Perfect. Chief Muncie, thanks so much. It's always a pleasure talking to you and just your knowledge base of technology and being innovative and proactive, preventative for your fire department and for your firefighters. So appreciate your time and always the dialogue. Really, really happy to be here with the IAFC. Thank you for your time. This is important stuff. We have such great technology out there. How do we use it? How do we learn from it? How do we be proactive so that we can keep our firefighters safe while they're in the field and at home? How do we get them to retirement healthy, happy, and enjoying their life and having a better quality of life? I do want to introduce to my left here, this is our chief product designer of the custom Transcend program and the wellness platform, Danielle Dingley. She'll be jumping in and helping me through this to explain how we want to help and come alongside each of your departments and your respective firefighters. So just a quick background on myself and how we came to Transcend Healthtech. I've been in healthcare really for 20 years. I worked for some of the biggest pharmaceutical companies in Merck and Company and also Thermo Fisher Scientific. So I've had a really good background in pharmaceuticals and diagnostics and how one can lead to the other. Hopefully, more diagnostics with technology leading to more pinpoint and precise therapeutics. I started advanced therapeutics here in Southern California, where we're based, and had that company thriving and sold to Walgreens in 2019. Started Transcend Healthtech really to get refocused on how to integrate big data, artificial intelligence into the health delivery system, focusing on prevention and wellness. That is our goal, to not look at sick care, reactive care, but how do we look at prevention, being proactive, and using data to lead to better decision making in the healthcare space with doctors, with key stakeholders, and for chronic care management and chronic disease. So next slide, please. So just a little bit about us. We're trying to take health tech to the next level. We feel like there is a major disconnect with some of the technologies. There's a lot of things going around about AI and really what is AI and how does it impact the everyday health and prevention for firefighters out there. So we are going to explain exactly where we have taken this concept of AI and how we can focus it on prevention and health So when you look at what we're doing, we have a number of services that are built off of the information and the data that we have, and the AI that we capture into our custom proprietary platform, and have an ecosystem of telehealth or telewellness solutions, direct primary care. We have mobile teams of nurse practitioners and PAs and RNs that come to the fire departments to be able to screen and do annual wellness visits. And it's all driven into one hub of data that can be shared with many stakeholders. Because one thing I want to point out is we are not trying to replace the benefit design of the major insurance companies. We are a supplement to, and will be a sentinel for chronic disease and prevention with your firefighters. So our goal is to share our platform and how the data leads to the services that drive lower cost and better healthcare outcomes. So just to set up the problem, we all know that firefighters have one of the highest rates of injury and illnesses of all occupations. We're risk of fatal injury 26% higher than risk of all other workers. Non-fatal injuries, firefighters risk more than twice as high the risk of all other workers. There's no running from this. We're realizing that cardiac issues, cardiovascular issues, heart attack, strokes have always been prevalent. But one of the other glaring risks now is cancer. And this is something that we've taken a particular keen interest to, in being able to find point of care cancer diagnostics to add into our annual wellness visits and our workups, the screenings that we do twice a year for our firefighters. So we know there's a big problem. We understand what you guys as firefighters go through on a daily basis to put yourselves at risk for the community that you serve. We have solutions that feel we can jump out in front of this problem to be able to keep people safe and keep the firefighters safe. So I'm going to turn it over to Danielle now. She's going to walk us through the solution so you can start to peel back the layers and understand how the data marries and meets the services that we can provide in the trenches. Danielle?
Thank you, Mike. So basically, we're going to start off, most simply, we're starting off with a smartwatch. We have a smartwatch with custom programs that we've designed and developed that are very specific for the unique needs of firefighters. All your firefighters would get a smartwatch. It would be connected to our digital health platform, which Mike talked a little bit about a second ago. And again, the entire thing is created specifically for firefighters and their unique needs. So that's a quick rundown. Mike, can you be my slide person? Of course. Thank you. So this smartwatch, this is an example of the kind of smartwatches we work with. We have products for both the Apple Watch and the Garmin watch. The whole idea would be that this would be department issued and that every uniformed officer would receive a watch. It would only be worn during the shift. And so you could imagine you're a firefighter, you go to the station, you clock in for your shift, you go put on your uniform, including the watch. You wear the watch the entire time while you're working. That includes showers, sleeping, when you're out on calls. And when you are done with your shift, you clock out, you take off your uniform, and the watch stays. So that's one major premise, because it's about the data we're collecting, and we want to collect data while they're on the job, basically. So the programs that we've developed for the watch, we have a activity tracker, which I'm sure a lot of you are aware of. These, anybody who's had an Apple Watch or a Fitbit or any sort of fitness watch usually comes with an activity tracker. The watches use technology that have special sensors in the watch band that touch your skin, and they can then read certain vital signs, your heart rate, pulse, blood oxygen levels, and then we're going to be able to get, with other information, we can figure out things like your step count, the distance traveled, calories burned. For our activity tracker, it will automatically detect when you go from sitting to standing, walking to running, going upstairs, and when you start a workout, specifically like a cardio workout, it will detect that you're starting a workout, and it will kick you over to our fitness app and start tracking it there as well.
Just to elaborate on this as well, one of the key parts and components of the program in phase 2 or year 2 of working together would be to be able to tie engagement and metrics to be able to incentivize these firefighters to keep at their workouts while they're on duty as well.
So in addition to the activity tracker, we have the sleep tracker, which this came about because when we started talking to firefighters in the early stages of this concept, that was one of the first things they asked was, is there a sleep tracker as well? Which actually makes a lot of sense to use because, you're going to be wearing this watch throughout the shift. You sleep on shift, and this is going to allow us to track the quality of your sleep. How much sleep are you getting? What are the different stages of sleep that you're reaching? But most importantly for us and for firefighters, we want to measure sleep disruptions. We know that disrupted sleep and disrupted sleep patterns can have such a detrimental effect on your overall health and wellness. All of the information that I have on that is information that I got from the IAFC report on sleep deprivation. So I'm sure all of you are probably aware of all of the negative results of having interrupted sleep. So we thought this, and this is another reason why this product was so perfect for firefighters, because we have a unique population of people that are working and sleeping while they're at work. So it's a perfect opportunity to be able to track this for them. So then we move on to these more custom programs that we would, initially we would want to do a pilot and have the department sit with us, and we really want to talk through what do you want specifically. Fitness is such a huge component of this. I hope that most departments have actual fitness time built into their shift schedule. I am a huge fan of the Wellness Fitness Initiative. And that, honestly, early on in this project, Mike presented this whole concept to me. I started doing research and I came across the Wellness Fitness Initiative, and that was like my North Star. It was like my guide. You guys know the health and wellness issues that you face. You have solutions that you figured out. You did an amazing, thorough job. And so that was really the inspiration for this product. And so specifically when we're talking about fitness programs, which you can see on some of our mock-ups here, I have different fitness programs like the Wellness Fitness Initiative, the CPAT, recruit training, things like that. We want to create a very specific custom fitness app for your firefighters based on those protocols that you want to implement. If you want to use the Wellness Fitness Initiative, let's do it. If you guys have a department CrossFit training program you've adopted, let's build that into this program. We want to track it because while increasing engagement and getting people excited about using this new fitness program, we're still able to track all of those biometric data through the watch the entire time, which is going to give us that much more useful information so that we can make actionable decisions on later.
And just to piggyback on this is, as we're saying, tailored. So fitness is such a big part. All of the different fire departments and going back to, with Chief Munzie over 6-7 months ago, fitness is such a vital part. How are we tracking it? Not just with kind of Big Brother looking over your shoulder, but how can this be tailored to making sure we're staying in alignment with some of these key, certifications and initiative, ongoing training, but how can this also be a personal accountability factor for the individual firefighters that are out there wearing this watch and track their measurements? There's a number of other components to this, the diet, nutrition. It's wrapping it all together, and I'll show you that shortly. But this is such a key ingredient because, again, we want not just to put a Band-Aid and find solutions temporarily, but we want this to be a paradigm shift change culturally, and to be able to give the resources and the technologies to help create a better fitness level for the firefighters long term. All right.
So with the watch and all of these custom programs we've developed with the watch, there is a mobile companion app. Again, these apps can also be customized. I want my biggest priority with this whole project is user adoption. I want firefighters to see this and use it and want to use it. So by having a lot of really cool programs on the watch, that's great, but honestly, like, I can't see that well on a tiny watch face. So of course we're developing mobile apps that if you want, you're doing your workout, the watch is checking your vitals, but at the same time, you can go ahead and on your phone, record your sets, your reps, or your cardio, your run, whatever the case is. So essentially what you're really getting is a watch with the watch programs, as well as matching companion mobile programs that you can access on your phone. Eventually, we would also like to have a web interface app. That's something that's in development too.
Yeah.
So
another big thing from a test group is that there's so many things off-label or supplements, nutrition stores that people utilize to be able to get in shape. When you have this app, you have access 24/7 to nutritionists and to your wellness counselor to be able to send by text or chat. We have a 24-hour response time to be able to get back to them. But if there's a certain product that a firefighter is using that's not necessarily a doctor or clinician is not aware of, this is where we can come in to be able to give them perspective of whether that's going to help. And that's going to be based off of a targeted plan of nutrition, health, fitness, and wellness for each firefighter. This is customized not only on a macro level, but on a micro level to the individual firefighter. And the resources are there, all centralized through smartwatch or their own mobile phone.
And the mobile phone is another it's another point of input for data, right? Because that's where you can personally enter your own data, and all of that is going to get combined with the other data from the watch into our cloud, which will then be part of your personal health profile.
Yeah. So, I mean, it's essentially the individual has this on their own phone. So for privacy and HIPAA perspective, having their own healthcare wallet, when you see what the workup looks like in our health assessments, a lot of this data is going to be available in their wallet so that they can have it whenever they need it.
And so basically, so after that, we kind of walk through this whole situation. You are a firefighter, you go to the station, you clock in, put on your uniform and your watch, you wear your watch the entire time. It's collecting all of that data throughout the time that you're watching it. So what happens after that? Basically, the watch connects to a Wi-Fi connection. Whenever it's connected to Wi-Fi, it will upload the data it's collecting to our secure cloud server. Some of the data may be kind of crossing into medical territory, so there is HIPAA considerations, and we have all of that set up. So this is just trying to give you an example of, it starts with the watch and the phone, you input data, and it goes up into our cloud. We have other offerings, which Mike is going to go into in a second. Mobile medical devices, telemedicine, those are some other things. All of those things are different capture points. And when we capture data with those things, it all goes up into our cloud, where we have what is our secret sauce, the artificial intelligence. And that is what is really going to be able to take these massive amounts of data and give us some actual insights that we can use and do something with. So this is just kind of gives you an overall view of kind of what our platform looks like. After our AI analyzes all that data, it basically spits out, the output is an individual health report. And these reports are so comprehensive. They have so much more information on them than anything you could get from your doctor, because we're feeding it with information that we're continually gathering while they're working.
Yeah. And guys, we're going to cut straight to it. I mean, listen, AI gets floated out there way too much. If there's a lot of buzz about it, it's great. But AI is only as good as the inputs the human, the physician, the clinical, the data scientists feed into it to be able to look out for your blind side as a firefighter, right? So what we're trying to do is take AI and make it actionable. We're trying to look at when a patient has, we get a data dump, hopefully from a key stakeholder like a TPA, third-party administrator, or a payer, and we do our initial baseline of all of our assessments and the diagnostic screenings, and we come up with this risk assessment that I'll show you in a little bit. We're going to be able to know if there's a patient that has diabetes or has had an MI or TIA or stroke or something in the past, and be able to set up certain metrics proactively for when they are in the field or they are working out at the firehouse, fire station, and we can set up something in the metrics of the AI to look out and ping our physician team if something is an alert and there's a high risk situation for a patient. That's proactive. If there's a patient that's sleeping and they have an arrhythmia through the night, and they're at the firehouse because they're wearing the wearable, we can have a text say, you need to jump on a consult, a tele-wellness consult, and or we need you to get to the urgent care and be checked out by a clinician in person. This is the type of proactivity that we're trying to reestablish in this healthcare delivery, all through the wellness platform, all through prevention. And so this is a really big picture of showing you how the data takes action with some of our services. And the key ingredient here is each individual to the top right of your screen is going to have their care report and be followed up with on a monthly, quarterly, and annual basis for us to roll up into an actual risk score and risk assessment, which you'll see in a moment here. Do you want to?
Oh yeah, sorry. So let's talk a little bit about the AI stuff. So if you are giving a firefighter a watch, and you're giving all uniformed personnel in your department a watch, they're wearing this watch throughout their multi-day shift. It's collecting data the entire time. That ends up becoming a lot of data. We are gathering massive amounts of data, and that's great. But if you can't actually analyze it or do anything with the data, then it's worthless for us. So that's when we really started looking at artificial intelligence and machine learning, because we started realizing that they're using AI in medical care, and they're finding that the AI performs things better. They're more accurate than doctors, right? There's less, there's no human error, basically. So what we want to do is use AI to very quickly and efficiently process all the massive amounts of data that we're getting from the watches, right? The AI allows us, this whole program really allows us to measure this program and measure the outcomes really from day one. Anytime you're purchasing a program for your department, you need to be able to measure it and show the outcomes of it. So this is something that we have covered. We're going to be able to measure continually from the moment they start wearing the watches. We will be able to hand you data that shows how this program is working. Machine learning, I just wanted to make a point about that. Machine learning is about continual inputs. So by the watch, because the firefighters are constantly wearing these watches, it's constantly giving data that is being input into our system. The machine learning is able to learn and adjust its processes based on the continual data that's coming in. So essentially, we have this set up where the more data that we plug into the system, the better the AI is going to work for us. Now, really, the reason that we're really interested in the AI is because you can take data sets from anywhere and combine them, and really the possibilities are endless now. So we want to see data. We want to see how disruptions in sleep may affect a firefighter's performance on the job the next day, right? Let's say that we have data from our program. We can combine that with data from dispatch, and that together will show us the exact point in time when a firefighter was injured out on a call, for instance. Honestly, like, the possibilities are endless. Once you start bringing in all those different data sets, we can really start to look for insights that I think nobody's even thought of before.
Yeah. So a couple things that I want to just elaborate on. Look, the machine can take massive amounts of data, and our algorithms are built by humans, by clinicians and data scientists focused on looking for certain things that are going to help us be preventative in nature to help the firefighters. Built by humans, read and analyzed efficiently by our AI algorithms. That's the key takeaway. And then spit out from the AI to be able to react with services in a preventative fashion. That's the key equilibrium. And what Danielle's talking about with endless possibilities, we have to temper our expectations of what we can do, because there's so much. Like we're talking about with cancer analytics. We have a mobile device for diabetic retinopathy for patients that's going to be able to capture and see if patients have diabetic retinopathy really early stages, even finding out if they have potential stroke implications from looking at the retina. There's so much that the AI from images can capture and come back to us so that we can then do a deeper dive with an actual clinician reading and measuring and looking at a diagnosis for a patient. So this is where it just kind of converges from just data and talk about AI into action once again. And I know we're going through, we have a lot of this because we want this to be a dialogue, and we're here to learn from you. There's a lot of great questions coming that Chief Munzie is going to kind of take one by one. But we do want to get through this so that you can have all your questions and we can be really interactive through this.
I see some really great questions around the side, so absolutely. I do absolutely want to get to those.
Perfect.
So because we're talking about data, AI, and all of that, I want to make a little side note here on privacy and data collection. When we first presented this concept to the firefighters way in the beginning, we told them our idea, and the first comment was usually, I don't want to be tracked, right? Now, I saw somebody, I think Corey asked, what about when it's off duty? That was why we said that the watch would only be worn on duty, because there was a concern that people said, I feel like my employer is tracking me in some way, and I'm not cool with that. So we actually had to sit down and really kind of go through our entire concept again, because we realized we have to make this a way, people have to feel comfortable and have to feel like it's not like we're not farming you for information. We're not taking your data and going to sell it somewhere. We're not about that. We are trying to find important medical insights based on this data. So talking about the privacy and the data, we just want to say right off the bat that management never has access to the data. When Mike first presented the concept to me, I immediately imagined I would get a watch and my boss could go in his office and pull up a tablet and look me up and see my location and what my heart rate is and what I'm doing. And my first thought was like, no way, I don't want to do that, right? So when we went back to the drawing board, we said, management, it can't work that way. And I do want to put that out there. It's not like your manager, the chief, or whoever can just click on a program and see exactly what you're doing and what you've been doing. It's not like that. Data is shared between the user, the person wearing the watch, the firefighter, and us, Transcend. Data is shared between the devices and our secure server only. Because when designing this, I really want high user adoption, we wanted to design it so that it's very easy to use. And in order to do that, we want to kind of copy the other apps that are out there. So I want everybody to know that they can go into the settings of our app and toggle on and off what you want to share or do not want to share. I want to be clear, you're only sharing it with us at this point. Now, when that data goes up to our cloud, and we have our AI and our machine learning capabilities, one of the things it's going to do is take all the data, it's going to aggregate it and turn it into non-identifiable data, so that when we sit down with management, with labor unions, with whoever the decisions makers are, we can sit there and we can say, here's all the data from our program. None of it is personal or identifiable, right? I think this is how you guys usually run programs like this now. I think usually whatever data used to review results, it's non-identifiable. So we would want to follow that path and stick to that. We would basically have an agreement in place ahead of time that quarterly, annually, we would sit down and give a report with all of our findings using all of this data.
I do want to add, though, this is customizable. So if there's ever a team, and I see that there's different, different care teams and whatnot that are part of different departments, if there's ever something that is on board with labor and management alike and the individual firefighters, and they sign off, and there's a point to de-identify the data in any way, we have the ability to do that, but we're trying to find an entry point that's non-intrusive, again, easy user adoption by all. And we know that we live in an environment where we have to appease both sides of the house on labor and management side. So we want to be able to have this be a glue that keeps people together, all pushing towards the same goal of keeping our firefighters safe for the long haul, using this data and not having it be a threat of somebody big brother looking over their shoulder, so to speak. And so we absolutely want to make sure that that's covered, and it is customizable. Any last thoughts on that?
No, you got it. That's great.
Perfect. All right. Why is this on our side? Okay, perfect. So let's get into now taking this data, a lot of data up front. And again, we can get data hopefully from other stakeholders to be able to have a well-rounded view of what some of the conditions are in ICD-10 codes and diagnosis codes and CPT codes that have been following the individual patients and firefighters. And if we don't have that, we're going to do our baseline workups with the patient. So when you look at our digital health platform, it is just for firefighters. We're meeting the firefighters where they're at. We have a next level of tele-wellness, not just going into your doctor and you're seeing the doctor over a televisit. We're going to go into how this takes the telehealth visit to the next level with unique diagnostic instrumentation that we have. We're going to make sure we're monitoring these patients with remote monitoring devices and other things that we can utilize, and then bring it to where they're at, either at the fire department, at home. They have access to these modalities and benefits of these of the wellness platform. So let's jump into this. Annual wellness exams. So the first thing we do is do a baseline where we will bring our NPs, PAs, or RNs to the fire station. We will do a baseline screening, annual wellness workup. The devices that you see on the screen are what would be done with our tele wellness physical. Essentially an otoscope, stethoscope, tongue depressor, and a device camera with a thermometer. We also have a mobile stethoscope to be able to look at other cardiovascular conditions. All of this data is in real time ported to our clinicians that are on a monitor, a screen, or on their mobile phone, and they're able to see some of these baseline metrics and chart them and diagnose the patient. So you're able to examine ears, throat, lungs, heart, abdomen, skin, and temperature, taking a telehealth visit to the next level with these patients. So telehealth and virtual health, you have the doctor, tele-wellness physician, and PPA on demand. So we have them available through the chat 24/7, and then we do up to 1 to 2 visits a quarter for each firefighter. So what comes out of this? We come in, we do a number of tests. We look at a whole cardiometabolic score. So we have devices that will, it's a non-invasive device that we bring in that looks at peripheral vascular disease, the autonomic nervous system, where you fight or flight mode. We look at endothelial dysfunction. We can have with a mobile spirometry device. We have a mobile DEXA scan and bone density. We have a number of other devices that we utilize, all in the initial baseline annual wellness visit. And we come up with a proprietary report that looks similar to this. And this is a very busy report, but at the bottom, you will see different levels of risk that will come in color-coded. And then this report to the right on these final 2 pages is a roll-up that's in layman's term for the patient to take away, and it will always be in their healthcare wallet if they want to share it with their actual primary care physician or a specialist if they see a specialist. These reports will roll up into a health risk score that will help hopefully improve year after year. And we have trend charts that are very easy to read so that the primary care physicians can help assist the patient in their healthcare journey from the wellness. So we roll up all of the data on the initial side, the wearable data, these health screenings that look at cardiovascular disease. And just to kind of put it in a layman's term, we take a look under the hood of their blood vessels, their nerves, their vascular system to see if there's a threat of heart attack, stroke, other complications, and then rolls up into diet, exercise, if you see this wellness plan, foods, supplementation, what their suggested level of activity should be, if they shouldn't go out and try to be the weekend warrior if they haven't ran for 2 years. We're going to have this report say light jogging or walking, and then hopefully over time they're going to be able to be greenlit to do some running and better exercise, because their overall health is going to be in a better place. We have the ability to bring in one of these devices into your fire departments. This has a height, weight. Think of it as a mobile or a virtual kiosk of a MA or a medical assistant or a nurse at each fire station. You step up. It takes a scan. You put your hands on one of these bioimpedance electro scanner. Everything is QR code, so that when you check in, it has your code from your healthcare wallet. It's scale. You put your arm into the temperature sensor. It also does pulse oximetry and photoplasmography, so looking at heart rate variability. I know there was a question on that. Height, weight, and then it prints out your health wellness score right at the kiosk. They can then connect right on the screen with their health and wellness coach to go over the results in real time. This is another level of what we can offer. This is not in our baseline pricing that I'm going to be sharing with you. This is another additional thing, but this just goes to show you guys, we have a lot that we can do with a lot of great partnerships and other diagnostic instrumentation. We want an entry point to be able to build a relationship and get your firefighters healthy. We do have other on-site medical services. We have the shipping containers very similar to this that we can put on site that come no human nurses, PAs, anything like that. Everything is already pre-wired and ready to be able to utilize all of these, whether the kiosk is inside, flat screen, all of the devices similar to this. This is, these are the otoscope and the stethoscope. All these devices come in a little kit like this and are able to be at each fire station. They can also be in one of these medical units if that's another level that you want to look at. Is there anything else on this side?
We're also currently working on mobile medical vans, which we don't have the images for that yet. So we only have images right now of the actual units. But I think that's going to really be the next really big popular thing, is that we're going to have our teams in a mobile medical van that is totally equipped, go to wherever your location is, do your annual wellness visit or whatever you need. So that is another offering that we have.
Yeah, so these vans will be able to have a lying flat exam table. Our tests do need a patient to be lying flat, and then we stress the heart and have them stand up. So we look at hypotension, not just hypertension. We look at a different modalities. So these vans are going to be like a medical clinic on wheels coming to your fire stations. All right.
This was mine. So this whole watch project was my passion project, and then I'm excited to kind of hand that off to somebody else, because then I want to focus on this part, which is the behavioral health portion. This is in the works and something that we're working on developing now. I think this has the biggest potential for the future of firefighter health and wellness. So we want to basically utilize our existing technology. We have the watch, we have the apps on the phone, and we want to build within that an entire mental and behavioral health and wellness program. Essentially, what we want to do is have resources and tools and a direct link to certified medical professionals, or maybe it is there's I wanted to call them peer trainers. They're not
peer-to-peer,
right, the peer-to-peer specialists. So maybe some sort of exchange where they can confidentially speak to each other or reach out. Essentially, my dream for this part of the program would be, imagine there is a firefighter that's out on a call, and that person, there's a high stress, high trauma situation that they encounter. The watch and the AI can recognize this due to the vital signs, and can recognize that this individual encountered a possible high stress situation. From that, our technology is able to automatically spit out maybe a pop-up, a survey, or something on the watch that just says, it looks like you had a high stress incident today. Is this yes or no? If you say yes, it's going to say, do you want somebody to reach out to you? And that's it. We want to make it as simple and seamless as possible, non-invasive. All of the mental and behavioral health stuff is going to be buried in our existing app. It looks exactly the same. You don't have to worry about, I don't want to open that because people are going to be like, what am I looking at? Am I talking to a therapist or something like that? I think that there is so much potential in this route, and I could totally do a whole nother webinar on it.
Yeah.
So I just want to this is stuff that's in development. And if anybody has any ideas or feedback on that, please reach out to us. I would love to hear from you.
I do want to piggyback on that quickly. This isn't Star Trek stuff. I mean, there's a company that we're working with right now to figure out how to integrate this into existing Garmin or Apple Watch technologies. They have their own watch right now, and they have similar makeup of what this looks like. We can work with them because it all feeds into our AI platform. That's the kind of takeaway. Even if there's a lot of really cool behavioral health, mental health companies out there that are popping up, we want to be able to open API, sync data, help streamline these great services or unique devices into this platform for the firefighters that we have and the departments that we have under contract. So this is kind of where we're going. Hugely important, especially after COVID, vaccination issues and all the uneasiness that you guys are going through. We hear you, and we want to help in this very underserved area. So quickly, let's highlight why our program.
So increased engagement. Honestly, if my boss came to me and said, I want you to start doing a fitness program at work, I'd be like, I don't know. But if they said, here's a brand new Apple Watch, I might be more inclined to listen. We do think that this is going to help with engagement and user adoption across the board. With our program, you're going to have better health outcomes. Obviously, you're really across the board from physical fitness. You're going to see decreased medical costs, decrease in absenteeism, decreased workers' comp, injury. That's kind of Mike's area, and I'll let him go into that. He's going to go into more detail on that stuff in the next few slides. And then we have reduced costs that's related to all of that, right? So reduced healthcare costs, reduced workers' comp costs, all of those things will translate into a dollar amount savings for your department. Yeah. And then finally, one of the most important things is that we have data for you. We will reduce your healthcare costs, but that's going to take time. We may need to work on this program for a year before we're actually going to see some of those things in the end. But we can immediately hand over data to you from the moment that we start this program. The data is what you guys can use when you're asking for funding, more staffing, more resources, what have you. It's data for management, for labor, for the unions, for everybody. This is something we're going to be able to hand over to you immediately.
Yeah. And the data is going to roll up into a very clean dashboard so that you guys have access to it, or we can show you, because what's good is data if you're not doing something and making a difference with it. Mm-hmm. She makes a huge point, because I'm in the meetings where you're talking to labor and management, and people are trying to get on the same page. We feel again that this is an equilibrium here. This is a unifier, not a divider, because wellness budgets should be agreed upon to help prevent, to help keep people safe and healthy, the firefighters safe and healthy. This data is going to help drive it, and it's your data. So go ahead.
Okay, so return on investment. Mike is going to get into pricing in a minute, but I just wanted to go over the overall return on investment. We are anticipating an ROI of 3-to-1 to 6-to-1. These are based on our own internal forecasted numbers. We are here to talk about, we want to do a pilot, and we want to partner with a department to really actually start to test this program out. But based on our internal numbers, we think that out of every dollar spent on our program, you will see a cost savings of at least $3 to $6. Personally, I think this is very conservative, and I think it's going to be a lot higher than that.
Yeah. We'll show you that too, but
I just want to make a note about the time because I do want to get to
perfect.
questions.
Yeah, so let me kind of rapid fire, and there's some great questions. So I building up. I want to just quickly go over a couple slides to our pricing. So one, we all know this. That there's a focus on acute events. It's very reactionary, sick care. Problem with healthcare is it's focused on treating illness. Putting Band-Aids on. We want to shift that paradigm to the benefits of a wellness focus on healthy and avoiding illness, lowering the costs, and improving the quality of life is the key takeaway. The data disconnect, that data is disjointed and not easily transferable. Benefits platform can connect easily. That's our platform, and connect with stakeholders. So there's a question about other primary care data and TPA data. We want to be able to share this data privately and securely, but get a big holistic picture of what has gone on in the past with the firefighter that we're treating and what's going to be prevented in the future. So we like the care coordination of data. And so unmotivated people, not motivated to take action. Platform creates intrinsic motivation for us, and intrinsic motivation is higher adherence and long-term goals for everybody. Lack of accountability, healthcare creates reliance and interdependence on that. Benefits of shifting away from helplessness to empowerment, and more long-term success is the end result. So we want to shift the paradigm away from ED visits and urgent care visits. That's how we're going to really lower overall costs in your overall benefit design, especially if you're self-insured, and decrease ED visits. Sick leave, increasing sick leave causes overtime costs and reduced staff daily. You all know this. Benefits immediate telemedicine, telewellness, access to the provider. Results quicker return, clear documentation. Work comp and overall satisfaction go without saying. We're going to lower that work comp if we can keep people healthier overall. Cost structure, just to give you a background, and then I'll get to pricing. ED visits, if you're self-pay, and you guys all have insurance for the most part, but the bottom line is, you're paying a lot on the self-pay side, but even with insurance is the takeaway. Co-pays are still going to be tremendous expense to the firefighters individually. And then if you look at the different healthcare delivery models of cost, telehealth is still, it's starting to increase because of COVID. Subscription models that are out there like direct primary care can be pricey, and concierge medicine is quite unaffordable. Our cost structure is $75 per member per month. This includes 2 in-person diagnostic screenings per year, where you get a battery of diagnostic screenings from diabetic retinopathy, spirometry, all of our vascular assessments, cardiovascular assessments, bone density. There's a number of other that go wrapped into that.
Extra cancer screening.
Cancer screening, and so we can get into that at another time. Quarterly wellness virtual visits. So you're going to do that. You're going to have preventative screening, and you're going to have an ongoing risk assessment analysis per member. And you're going to have 24/7 access to the nutrition counseling and the wellness counseling by text chat. And then you get your 2 quarterly visits every quarter. Employers, this is a carve-out benefit under the wellness budget. This is supplemental to existing insurance benefit. It's focused on benchmark metrics to assess ROI, and the goal really is to mitigate costs and risk for self-insured benefit designs according to your needs. And the key takeaway, membership. Focus on the satisfaction of the firefighters, motivation, transparency, and accountability to build a stronger, healthier, and happier workforce. Lastly, what we're looking for here is we're looking for a pilot. In a second, Nan's going to send out a questionnaire that we'd love for you, if you're interested, to fill out. Send it back to IAFC, or you can send it direct to us on our website, transcendhealthtech.com. But we are looking for a specific pilot, have a wellness budget, able to act on it. It's a pilot to contract. We will put our money where our mouth is and provide the pilot department with the Apple Watches, with the instrumentation, with everything to be able to assess the ROI. And this will turn into a contract, because it will be upfront negotiated into that pilot to contract term. So we do have some questions that are rolling out here. I'm going to bypass that. So go ahead and answer those. Just when you look at the buy-in, we need full buy-in from both labor and management. That is a key ingredient, and we feel like we can help aid in this because we are, again, not talking about changing healthcare benefits, which is very emotional to not only the departments, but also to other stakeholders, and to the main stakeholder, which is the firefighter and their family. So this is, again, under the wellness side, and we need both labor and management. We need agreement, and we need a phased rollout to look at how we can customize to find the best long-term solution for you. Anything to add before we go to questions? Perfect. So, Chief Mundy, if you want to start with any of the questions.
I would, Michael. Thank you. Michael and Danielle, just great. A lot of feedback on the chat from the various chiefs here. Some are pretty high profile that are impressed with what you're doing. John Dennison, who's a battalion chief in Cedar Hills Fire Department, asks, which departments are currently using your product at this time?
Great. Yeah. Thanks, John. So we're not. This is a new product. That's why we're rolling this out in a pilot phase. So we have done our extensive research, but we're looking to pilot this with. This is the goal: getting your feedback, tying a bow on it, assessing the needs, customizing it, and we will be providing this pilot free of charge in the pilot to contract phase.
Thank you. And Rogers Fire Department Captain Joshua Kirks asked, will the watch track and report heart rate variability? Does it use the foundation of Garmin's does it use the foundation of Garmin's body battery, or does Transcend use their own metrics?
Both. So we do look at HRV. We have our own assessment and modalities of looking at HRV with photoplasmography and some of our devices, but we also use the chassis of a Garmin watch or the Apple Watch 7. So either one of them can be synergistic, and it's all where there's going to be times of with a wearable of continuous HRV monitoring, or using it when we do our annual wellness visits with our NPs, PAs, or RNs.
Thank you, Michael. Is the Transcend cloud safe? Will it protect our employees' data? Is this HIPAA compliant?
Yes, to all. I mean, this is the most important of everything. We can, when we get to the pilot, or when looking to contract, we will go through a thorough kind of background of all of the certifications and the protections. Go through, as we talked about earlier, whether or not there is any need for de-identifiable data or to be identified, and that would be customized. But absolutely wouldn't have this model and this platform if it could.
You mentioned earlier that it's important that this data is collected in a very transparent manner between labor and management, that it's really designed for on-duty. But have you had any considerations of doing 24/7 on a voluntary basis of our employee monitoring?
That is our
off-duty as well.
Yeah, I mean, that's where we want to get to, right? And really, Chief Munzy, and you can know back to our early stages conversations and some of the other betas from developing this platform, we want to get there. We want to be able to provide every firefighter with a wearable. We would love to provide their families with a wearable, and also having these devices in every home. Right now, we need to find an entry point. We feel like that entry point, to make sure labor and management agree, is just protecting the blind side of the while they're on duty and collecting the data while we can.
Very good. And Greensboro Fire Assistant Chief of Health and Safety, Ronald Young, asked, will this webinar be recorded and available for the Fitness Committee and Wellness Team? Absolutely. This webinar is recorded. It will be on the International Association of Fire Chiefs Tech Council page. You should be able to access it within a week. The cost points were covered. We appreciate that information. I do want to point out that there's a handout section on this webinar. If you click on there, you'll be able to download a pamphlet on Transcend Health that will provide you some additional information. Assistant Fire Chief of San Marcos Fire Department in San Marcos, Texas, Carl Kuhlman, asked about the battery life. How long will the battery last?
Yeah, that's great.
Battery life it's quite impressive now. The battery life on the watch lasts a long time. I don't know how yours is, maybe at least a week. For people that are working a 48-hour shift, you have no problem. You are going to have plenty of battery life that's going to last way throughout the shift. You're going to have plenty left over. if we were to roll this out and where people were wearing the watch all the time, even when they're coming home, that is something we would have to take into consideration about charging and when that's going to happen. But as far as wearing it on shift, you are totally covered.
South Marin Fire Battalion Chief Jason Golden asked, who's also the chair of the Behavioral Health Committee, by the way, mentioned, will this technology work with the individual's pre-established primary physician, or is this only available through the doctors that work with telehealth?
Our vision, we do not want healthcare fragmented. We do not want to replace, again, the emotional connection to the PCP. PCP is vital. They are a quarterback. Throwing the pass to the specialist or to a mental health professional. We want to be a layer, sort of the kind of backup quarterback in the so to speak, because we're not going to see them maybe as regularly as the primary care provider. In some cases, our NPs and PAs and RNs may see the firefighter more often than their PCP. Again, prevention. We don't want to put necessary limitations on how they access the counseling and the information to keep them healthy, but we absolutely feel that care coordination between specialists, PCP, and the subspecialists out there is vital. Even counselors, therapists. We're looking at a program right now for virtual physical therapy to be able to look at PT, and there's some devices that are really cool that can be placed even at the fire station that transmit data based on and range motion improvement and flexion, even post-injury. So there's just so much we can do. Our platform wants to sit on top of it all to get data from all these key care coordinators and clinicians and stakeholders so that we can make informed preventative decisions. So great question. We absolutely want to move towards it.
Kirk McKenzie, who's a retired captain, who's a technologist, so to speak, for public safety. He's really out there and does a great job. He wrote, there's a great discussion already. Once a base fitness lactate threshold is established, running ML, which is machine learning and AI, artificial intelligence, the team is well positioned to assist IC with rehab planning on working calls, with custom metrics to orient to individuals, LT/AT, and assist in minimizing risk for coronary event. He says, if memory serves from the WFI, the first side is approximately 60% of coronary artery disease is an MI. May I ask, are we close to carboxyhemoglobin monitoring?
Yeah.
And so I'll mention that Kirk was also an avid semi-professional bike rider too, so he's very technical in his questions.
Awesome, Kirk. Well, we appreciate the feedback. I would say, number one, from a lab and diagnostic side of that, we will take blood work too in our assessments, and then as far as the monitoring, I think we're close. To answer your question bluntly, but we will. We're not there yet on that side. But I wish Dr. James, one of our partners, he is our medical director. He would have a little bit more insight. I will pass along this question, Kirk, to give you a timeline. But there is so much that we do with the lab workup and the blood workup and getting all the other information from the primary care, as the other question was. And then the diagnostic monitoring that we do is next level to be able to really, again, take a look under the hood at arteries, blood vessels. When you see these reports, and this presentation will be available for you, you can look a little bit deeper at the sophistication of the cardiometabolic score and those reports. You'll see the type of information that we're going to get. And the most important takeaway of all of this is that we feel we empower the firefighters once they get these scores and get shared this information. We feel that there's not enough good information being provided by clinicians to the end user patient to be able to take accountabilities and really take their health to the next level. We want to create and motivate and make it a win-win-win for wellness for all.
Michael and Danielle, I want to thank you for presenting to the Technology Council and our other members that are here. I want to thank those that have joined us live and those that are reviewing this at a later time. We've already done the question and answers, but again, I want to thank our sponsor, Transcend Healthtech, We do have some upcoming events that I briefly want to mention. They're on this sheet here. We have the Wildland Urban Interface Conference, March 22nd through 24th in Reno. Community Risk Reduction Leadership Conference, May 24th through 26th in Toronto, Canada. International Hazmat Response International Conference, June 9th through 12th in Baltimore. Fire Rescue Med, July 12th, which will be a virtual experience. Fire Rescue International in San Antonio, Texas, August 24th through 26th. And then the Technology Summit's proud to announce the first ever Technology Summit International, also known as TSI, October 18th through 20 in Irvine, Texas. Finally, Symposium in the Sun, November 10th through 13th in Clearwater, Florida. You will receive a link today of the recorded session by email along with the brief survey. Please let us know about your experience today. Let us know how we may be able to serve you better, some content that you might want to see. Any feedback from Transcend Help, we'll make sure to communicate that to them. Thank you all for joining us, and I'm going to go ahead and end this broadcast. Thank you.
Thank you.
Thank you, Chief Munzie. Thank you all. And put my email in there if anybody has any questions. Appreciate the time.
Thank you.
Thank you, folks.